diagnostic white hat valve disease. Mitral regurgitation in first place in arteries. In second place, aortic valve disease. Right. What you know? Heart. Right there, very big chunk. Left atrium. Вот я видел.
Mitral
Рекатик он майтру. Left ventricle. And вот here, very closely, вот near fifth point of squintation projection. Semilunar valve, from right atrium, pulmonary artery. Same with semilunar valve. Вот, if normal systole, what will be systole? This valve closing, да?
Yes.
Right? Normal systole. And blood inside in
aorta
what the
and
greatest
pulmonary
pulmonary artery. And what sound will be?
S1
First sound was S1. Atrioventricular valves closing and ventricles contraction. Second sound. If we auscultate the apex and xiphoid, first sound louder. First void. That's it. No, that's the distance. If mitral regurgitation, это вот новое. If mitral regurgitation, what will be? In mitral regurgitation,
blood goes back to atrium
restriction of this cusp.
Systolic.
Why restriction maybe? Restriction after past rheumatic fever. If patient missed proper treatment, and especially first 1-2 weeks. Patient say joint pain, migraine and arthritis, fever, and all opinion on the joint. First day here no marmos, only tachycardia. Вот. И выmislо cicatrization and restriction, what result will be, что if systole, blood regurgitate
atrium
in left atrium, and dilatation, hypertrophy and dilatation of left atrium. Gradually we find, что apical impulse shift, left border toxialized, insert interspace, left contour widening, because left atrium shortened, because left atrium dilatation. Это squintation on the first point, what will be? First sound. S1 decreasing, and what? One systolic marker. One means total system. Wow. What will be your first point? Because here blood regurgitated, accented, second sound and pulmonary artery. What clinical picture? Mitral regurgitation. Other causes of mitral regurgitation.
Infective endocarditis.
атеросклерозис. И атеросклеротик,
Legs.
да, flex, decardиum, or closely. Same here may be restriction, sclerosis. Because surrounding atherosclerosis plaques, low-grade chronic inflammation. If you know from pathophysiology. But low-grade atherosclerosis, not only metabolic and structure, and inflammatory component same present. Maybe due infarction. If infarction maybe direct infection, papillary muscles, that join to
Hold it
to
in.
cast. And maybe because ischemia, same, not complete closure. What most common causes? This disease usually in patients with age. In young patients, only if they pass in childhood and when young adults acute rheumatic fever. If on basis acute rheumatic fever, diagnosis will be что? Chronic rheumatic heart disease. Это in Russian shortly, HRBS, with what? Mitral regurgitation. Mitral. No, and because incomplete in time left ventricle in aorta result in decreased
Cardiac output.
time fraction. Cardiac failure develop. Cardiac failure develop. Cardiac failure mainly with congestion in pulmonary circulation. But it's why maybe cough, no emphysema, cough. Maybe if congestion, mainly in inferior lateral parts, crackles, fine crackles. So frequent, maybe inferior lobe focal pneumonia, say, with cough, more sputum, maybe mixture pass, mild fever, and same, more crackles. Result development chronic congestion, inferior part, pneumosclerosis. If severe decompensation, sometimes maybe pulmonary edema. Pulmonary edema, what like today patient. In pulmonary edema, garden, the distant wet rails, distant crackles, breathing, and symmetrically many crackles, fine and coarse crackles. And all there's bubbling, medium, large, bubbling rails, because blood serum pass through the alveoli, bronchi, and cough maybe with foamy sputum, sometimes foamy pinky sputum, if not blood serum. What to this patient, he needs to give Fowler position or sitting, semi-sitting, to give oxygen, to give intravenous diuretics. No, if severe heart failure, like today patient, not high blood pressure, vasopressor addiction, norepinephrine, dopamine, because if low pressure, no effectiveness, no proper glomerular filtration, if systolic pressure below 98. No, this patient is very elder, 91 years, and was Yesterday, I see ultrasound in CT found metastasis in liver. Later, after what round, she passed endoscopy and is a large cancer of greater cavity of stomach. Так что prognosis very bad. Ну, really, это only symptomatic care. Very health, very serious heart failure. Additional, she has chronic kidney disease, то есть chronic renal failure, уремия, креатинин, там, 0,3, anomaly 0.06, 0.1 micromolar liter. То есть very decreased glomerular filtration. Как urea, more than 40, 50, anomaly 7, 8. То есть это вот. She prognosis not good. Really, she without, I don't hope that she survived more than 1-2 days. То есть maybe she needed care. Maybe what severe atherosclerosis of myocardium with involvement coronary arteries. Это что? Вот ischemic heart disease. Да? Ischemic heart disease. And same mitral regurgitation, heart failure. Do you remember heart failure? Heart failure in New York Heart Association, what maybe functional classes 1 to 4, or Russian Soviet Conference. Letter, это Russian M, like English heart, H. Maybe from first to third degree. Second degree, divide A, B. Это similar like functional classes to 1 to 4. No? In this patient, functional class 3, 4. Not conduct usual small physical load, dyspnea, then respiratory support, edemas maybe, what mitral regurgitation. No, and if mitral regurgitation, systolic murmur, better to auscultate in bed, what? Maximal of murmur, when apical impulse, maybe Botkin help, 5th point, and when patient turn to the left, conduction maybe in axillary space. Это вот mitral regurgitation, most frequent. On second place,
aortic.
in statistics, aortal regurgitation, aortal stenosis, but do not miss what will be if mitral stenosis. Mitral stenosis not so frequent, but more serious, more risk of severe heart failure, more risk of arrhythmia and embolism. What? If mitral stenosis develop usually on the basis past acute rheumatic fever. And same, это most frequent cause. But that's why it is now not very frequent. Because from 60 years, most of patients through have proper treatment with antibiotics, with steroidal and steroidal. No, sometimes atherosclerotic and congenital, maybe. What? If after past endocarditis, gospel mouse becomes very sick, rigid, because granulomas and next fibrosis. Adhesions maybe. What? Normally this orifice, an opening, 2-3 centimeters in diameter. And here maybe what? Only what? 2-3 millimeters. Clinical picture usually develop with narrowing in 3-4 times. What here will be? The result will be very difficult feeling. In mitral stenosis, difficult feeling. And left atrium usually is not enlarged. Size near to normal. No shift of apex. But very hypertrophy next dilatation of left atrium. More expressed than mitral regurgitation. Sometimes so widening that with compression subclavian artery, left maybe, and here, что? Asymmetrical pulse volume less than right, radial artery, it's taken. Вот. Ну, and mitral heart configuration developed. You remember mitral configuration? Вот normally on short level, short interspace, the waist of heart, I hear you what? Smooth waist of heart. Mitral rigid configuration of heart. Good visible on frontal X-ray. Not toilet percussion. No, and what? This, so, but in time difficult maybe, sure. Sometimes near apex was 4/5 interspace to you apply. You can feel diastolic thrill. Cat's pudding, direct translation from Russian. Кошачье мурлыканье. Like cat's thrill when you stroke. Вот. What will be the auscultation? If very dense, rigid,
Cranial rhythm.
what? Flapping, very loud and slightly duplicated. First sound, flapping, loud. It's the same at first point of auscultation. Clapping. What? Clapping. Second sound on first point, and not change. But normally opening of bicuspid, tricuspid, beginning without acoustic waves. I can will be because adhesion very closely to second sound. Opening snap. Opening snap. Opening snap. What? Direct translation from Russian. Click on mitral valve opening. Additional sweat sound. But the result will be quail rhythm. Triple melody. Это first point of auscultation. Вот. Sweat sound, not change. Sweat sound – это expanding of ventricle wall. What? Between first and second and third sound, there's 3. Normally, more than 0.12 seconds. Our opening snap was this distance. Normally, less than 0.1. Это we can on phonogram or graphical digital auscultation differentiate. Opening snap more closely than physiological sound. No, это what physiological force sound very closely near 0.1 to next is 1. And maybe diastolic murmurs at apex. When apex and fifth point. Where diastolic? Diastolic murmur. Maybe here, protodiastolic. You see? It short usually. Left and vertical position. Diastolic. Proto is first part. Or maybe what here, presystolic. Presystolic murmur. If no dilatation, if hypertrophy of left atrial myocardium. More forced additional blood feeding. What? Mitral stenosis. If not severe mitral stenosis, we hear only clapping first sound. In more severe cases, if stenosis, narrowing, only less than 1 centimeter flourishes, few millimeters, all this is qualitative picture. No, better that if patient pass digital auscultation, phonocardiogram, because we can see graphic, plus ultrasonography. Ultrasonography can visualize all these changes in size and shape of heart mass and walls. No, and accented use S2 accented increased. One pulmonary artery. Это сколько? We call it very dilatation, left atrial, increased pressure in pulmonary circulation. And congestion same mainly on lungs. But if patient has long time pulmonary hypertension, secondary right ventricle atrial dilatation. But at the break, I showed you few ECG to remind hypertrophy atriums and ventricles. And next class, I show you functional ECG, very clear. Well, what complication additional? In very dilated left atrium with better time, formation of emboli maybe, and intracardiac thrombus maybe. If small, they can pass in greater sequence, embolism, especially in brains maybe. But that's why in reality young patient who passed acute rheumatic fever, maybe suddenly 25 years, 30, 35, embolic brain stroke. And if dilatation of left atrium high risk of atrial fibrillation. Because the dilatation disorders intra-atrial conduction system. Atrial fibrillation, arrhythmical pulse, deficiency of pulse maybe. То есть heart beats more than pulse beats on the regular artery. Deficiency of pulse. What? Now break, and the break very shortly about the aortic valve diseases. And showing CG, we can remind you what diagnostic task with one diseases. No, and tricuspid valves, very rare diseases. Tricuspid incompetence maybe. Here, similar in mitral regurgitation. When first sound decrease at apex, I hear xiphoid, and systolic murmur. At xiphoid, and when patient turns slightly to the right, maybe conduction in short force interspace up to mid-clavicular line. Usually dilatation, right body relative dullness, all bodies absolute dullness, cardiac impulse maybe, right ventricle, enlarged right ventricle pulsation, in area absolute heart down, force fixed, palpable cardiac impulse and epigastric beat of right ventricle. What is it? Tricuspid, well, maybe, when the base is not only endocarditis, maybe due to very dilatation of right atrium, right ventricle in chronic pulmonary heart, secondary to mitral stenosis. Rarely, maybe after past endocarditis. Infective endocarditis, tricuspid valve, described in venous narcomanes. And especially narcomanes who had virus hepatitis, who had human immunodeficient virus, low immunity. But they use not standard solutions of narcotics, homemade, filtrated with microscopic pieces, cotton, fibers, paper, all of it. First from tricuspid valve. And then maybe very liver, congested large liver, edema of length, jugular vein swelling. Aside maybe, clinical picture maybe, similar liver cirrhosis, or if human immunodeficient virus, viral hepatitis, chronic hepatitis, same presence. We had few patients with such problems, usually young males, chronic venous narcomanes. First they was diagnosed like liver cirrhosis, and only after heart examination, heart ultrasonography, and because we find very changes, right heart chambers, percussion, auscultation, diagnosis was changed. And 15 minutes break or 20. After the break, second place, aortic stenosis. Do you know? What? Aortic valve projection near air point, certain space. That's right. Similar valves. The best point of quotation, second interspace,
Right.
one can stand in the water. Second interspace, second point. What? Normally, intersqueezation at this point. Normally, what? Second самое. Да? Нормально. И стенозис. Вот, stenosis, why? Most frequently on the basis of atherosclerosis. Maybe past in the normally same. Here 2-3 centimeters at opening. If stenosis and orifice less than 1 centimeter, clinical manifestation appear. No, maybe due to hypertrophy, very hypertrophy of interceptor, upper part, if here may compress, but most frequently if past endocarditis or atherosclerosis. Maybe same. Patients more than 40, 50, especially elder, like today. And higher, usually post-stenotic dilatation of aorta, aorta widening. Narrowing what here. And what result? Very difficult uptime. Very difficult. Result will be, это вот normally. If aorta stenosis, result will be decreased first and second sound. What here. And what? Diamond shape of rhomboid marble. What means? Increasing, decreasing. Crescendo, decrescendo. The best point here and conduction on carotid artery. What here maybe. Marble. What result for heart? Very relaxation of right left ventricle. And heart rate usually not frequent, bradycardia maybe, what? 60. Not frequent. What? Blood pressure. What? Decrease of systolic blood pressure especially. Because coronary artery, what? Coronary artery, right, left, up, the level, semilunar. Secondary ischemia. In patient and very small physical feels angina pain, stenocardia, brain ischemia, because systolic pressure may be 90, 100, rarely more than 110. And what? Headache, dizziness, disordered mental working ability. So this patient very suffer. What? No, at percussion you will find so. So-called aortal heart configuration, very expressive. Waist of the heart and apex beat may be 6, 7 interspace. It shifts to auxiliary lines. Very hypertrophy. Это aortal stenosis. And if aortal dilatation, opposite, restriction, semilunar valve. They very good, easy blood flow and systole, but the diastole will be что? Regurgitation. The aorta regurgitation. sound decreasing, decrease sound, and what? And что? Diastolic murmur. Diastolic murmur where second point and fifth point. Vertical position. Well, usually systolic murmur at most of cases more loud horizontal, diastolic opposite. Especially in this case, regurgitation more when patient seated state. And what will be very different? Systolic BP elevated 160, 170, and diastolic decreasing, usually below 60. So very high pulse pressure. Result, you will hear what collapse, you will see carotid artery collapse. Maybe synchronous with heartbeat, tremor of head. Maybe visible pulsation if pale sound, subclavian arteries. Here auscultation, without compression stethoscope, double sound of trouble, systolic, diastolic sound. If you press with stethoscope on latch artery, carotid, femoral, double murmur, Durazier murmur, systolic, diastolic. And sometimes, if very dilatation of left atrium, secondary dilatation of tricuspid valve and secondary regurgitation of mitral valve. То есть, additionally, maybe что? Systolic murmur at apex. And on fifth point same. Because very dilatation of this orifice.
Doctor, the fifth point, is it the F's point, right?
Then the point additional to mitral aortic valve because it is near real projection. What? This valves project very close, short interspace, near sternum. Bicuspidal directly on edge of sternum. Semilunar valves, normal position of heart. What's most frequent murmur? No, I show you what ECG is. Hypertrophy atriums by P wave. Вот normal P wave это, in most units positive and very small, 2.5 millimeters, because small myocardium. What you see, maybe half millimeter. Это good P. And now what here, good P waves. What will be, сейчас I have sample. What similar picture present in your textbook. What? Do you see? In some units, normally, second, third standard, high PV, 3 millimeters and more. Это what? P pulmonale. Maybe P wave splitted. Left atrium. No, what? This case, both atriums, hypertrophy. No, and if P mitrale, what normally in right chest leads, P wave positive. If P mitrale, in chest leads P wave with 1 second, negative, or B phase with prominent negative phase. Here, это You see, no P wave, atrial fibrillation. Atrial fibrillation, это if left atrial hypertrophy was frequently. What you see here, PV1 negative, slightly B phase and negative phase expressed. Maybe, and what see, same, slightly like 2 maximum, left atrium hypertrophy. То есть here 50 millimeter second, all wider. I here 25. That's why we want to see. At left atrium, P slightly splitted, especially тут. What? Second standard good visible. AV foot visible. Тоже splitted P wave. I here what V1, P wave, negative phase problem.
Doctor, it's like atrial fibrillation.
Here not. In atrial fibrillation, P wave not present. RR irregular. And in some leads maybe not no. You can see what fibrillation may be small amplitude, and maybe high amplitude. Yeah. What? Same, slightly splitted P wave, second. And what? Same here, prominent negative phase. Yeah. Это what? Maybe very good visible left atrial fibrillation. Maybe what like this case, only in 1-2 leads, small amplitude fibrillation. Compare. But in both cases, P wave not present and RR irregular. Yeah. Yeah. No, ventricle. Ventricle hypertrophy. No, it's a similar case. You see, very prominent people pulmonale. Ventricle hypertrophy. VSS by R wave. Most prominent ventricle depolarization wave. No what? R wave. What? Do you see? Normally, here not what? Normally, RV force most high, maximal amplitude, because normally apex near V force electrode, fifth interspace mid clavicle, what like this. More than V fifth, sixth. If left ventricle hypertrophy, apex shift to axillary lines. Result will be that you can see like here, RV fifth more than RV fourth, and RV sixth more than RV fourth. What most sensitive ECG sign of left ventricle hypertrophy. Elevation RV fifth and sixth more than RV fourth. It's because apex shift here, plus more width of lateral wall of left ventricle. If right, what normally, right chest leads, fourth interspace, right of sternum and left. They characterize mainly right hand chambers and normally RV1, RV6, small, and here deepest wave. And RV1, 6, no, maximally 6 millimeters usually. If to see right ventricle hypertrophy. Ну, RV1, это first standard. RV1 and V2, high 6 and maybe splitted. And why ST depression, oblique, это not ischemic. In very prominent hypertrophy, right or left, disorders in repolarization, and oblique ST depression, and asymmetrical T-wave negative, sometimes maybe. What is the right ventricle hypertrophy? Normally here small airways, as deep, here elevation. In left chest slits, if right ventricle hypertrophy, prominent S wave. Normally in left chest slits, S wave not prominent or absent. What is ventricle hypertrophy? Have equation. Next class, I show you in functions. And maybe if we have time, some other, but before control, we can repeat. And CG in textbook part 1, chapter CG. Там many pictures, это we copy CG from our false, including exam false. Вот. Ну, and if you want, we have time. We repeat situational task. 2 points. For situation time will be controlled. Do you want? Maybe I have to. Before exam, this task, you can see this similar task on level 2. On level 2. What? Please. Do you? Shall I find to issue you?